is it very important of family support?
Yes. Probably one of the chief reasons that people have relapses is one, it may be their denial themselves about their illness.
Welcome to A Better Life with Pastor Barbara Ann Reese, coming from Faith Life Tabernacle International, 500 Orinoco Avenue in Richmond, Virginia. You have not joined this program by accident, but this is your appointment to receive from the Lord that which you desire. A better life is yours today with Pastor Barbara Ann Reese. This is your day for change.
Let's join Pastor Reese in today's message.
This evening, I would like to welcome to A Better Life telecast Dr. Ken McDaniel, MD. Dr. Ken McDaniel is a medical director of the Henrico Mental Health Center. He is also the assistant professor at the School of Psychology in VCU.
Mm-hmm.
Welcome.
Yes. Nice to be here.
Tell us, how did you get started in the field of psychiatry?
Mm-hmm. I was interested in becoming a physician initially, and as I went through med school, I became aware of people's problems were far beyond just the medical issues. And as I was working with patients, I became far more interested in the whole person, the spiritual part, the physical part, and the psychological part. And I had sort of a knack for working with people, and I really started leaning toward the psychiatry from the very beginning. And after a few years in med school, it became very clear that that was clearly what I wanted to do. And so I invested the rest of my time in psychiatry and psychology.
So you enjoy your work?
Oh, yes, I enjoy it very much.
Yeah, it seems like you enjoy your work. Tell us briefly a little about yourself.
Well, I grew up in Cleveland, Ohio, and went to med school, and I came from a family that was very close, but had issues of their own. So part of my life in terms of becoming an adult was working through my own issues, which then helped me become interested in psychological issues and becoming interested in other people and developing whole lives. And so I live with my wife here in Richmond and practice full-time in Henrico Mental Health and at VCU teaching psychiatry.
So you moved from Ohio and came to Virginia.
Yes.
Oh, we are blessed to have you here in Virginia with us. Okay, there's people, there's a lot we hear about depression and how it have affect so many families. And we would like to educate the people out there. Can you tell us about depression and bipolar?
Sure. Depression is a state of mind that everyone is familiar with. Everyone knows what it means to feel sad, to feel down, to have blue days or periods of time when they feel down. That we consider normal. That's part of everyday life. However, people can develop periods of sadness or depression that go beyond the normal. They can have periods where they feel very negative, blue, down, hopeless, sad. And they have difficulty functioning. When people's episodes of feeling depressed and down go beyond the normal, that is, they have difficulty functioning either at work or at home and interferes with relationships, then we start seeing this as something beyond the normal and actually a problem that needs addressed. Depression can be quite variable from mild forms of depression, sometimes we call dysthymia or mild depression, but it can also become something far more severe. Episodes that we may refer to in psychiatry as episodes of major depression. We draw that distinction because people who develop major depression have gone from just a state of mind into an actual clinical illness that involves changes in their body and their nervous system that is beyond just feeling down or blue. We draw that distinction because many times it's hard for people who have never been through an episode of major depression to understand what the person is going through. Many times families have the impression that they just need to handle their down period much like they would handle feeling sad.
Yes.
So they oftentimes give helpful advice such as, you just need to get out of it, snap out of it,
Yes.
take care of yourself,
Yes.
play some happy music, pray, meditate, do something good for yourself, go get a haircut, you'll feel better. Not realizing that once people have an episode of major depression or even a dysthymic disorder, that these are actual changes in the nervous system that people can't snap out of no matter how hard they try. That actually their nervous system has gone through changes that need healing, and these actually develop into neurological and biological symptoms that are beyond just feeling blue and sad.
Yes. So, if I understand what you're saying, which I do, there's a difference with just the normal depression and we have manic depression.
Yes.
And manic depression is the one that you just cannot snap out of it. It's a disorder
That's correct. Yes.
that you need medical attention.
Yes.
The effects of depression are staggering. A recent study sponsored by the World Health Organization and the World Bank found major depression to be the leading cause of disability in the US and worldwide. 80% of suicide are carried out by persons who have depressive illness. 15% of people who have significant mood disorder commit suicide. Without effective treatment, the illness can lead to academic failures in our teens. 32 to 40% eventually drop out of school, and only 5 to 10% finish college. Children not able to focus and have classroom behavior problems. Children being neglected by parents who have bipolar depression. Adults with ADHD are more likely to have marital problems and multiple marriages. Even higher incidence of separation and divorce. Today we will be talking about ADHD, bipolar depression disorder. You would hear life stories on how others got their life on track and now have successful, productive life. You are not alone. Call the number that appear on the screen, or you may want to log on fltim.com. There's a difference with just the normal depression and we have manic depression.
Yes.
And manic depression is the one that you just cannot snap out of it. It's a disorder
That's correct. Yes.
that you need medical attention.
Yes. We have done much research over the last 100 years trying to identify when people can treat their depression or even manic symptoms in manic depression, when those can be treated with counseling, with therapy, with healing, and when is there really need to be medical intervention. And that's something that a doctor can help identify. But generally speaking, those severe forms of the illness, like bipolar disorder, which is manic depression, or major depressive disorder, it's very clear from 100 years of research is that counseling and medication becomes very important and sometimes essential.
What are some of the, I know sadness is one as you just said, but where does the line draw with the families that we can see that this maybe behavior or, that is going on? When would we know that, okay, we need to get help?
Yes, that's a good question. There can be mild forms of depression or even mild forms of bipolar disorder where even if it hasn't become severe, it's started to interfere with people's functioning at work or home. And that can always be addressed with counseling or getting an intervention of some kind, support for the person and the family. However, when symptoms become severe enough that it becomes what we call a true bipolar disorder or major depressive disorder, it's not just feeling sad. There are symptoms and changes in the body. And then when we start seeing those changes, These would be symptoms such as changes in sleep, appetite, weight changes, ability to concentrate, ability to focus and pay attention, energy levels, all of a sudden people having inability to even organize their thinking. It can actually become severe enough in either one of these illnesses that people develop psychotic symptoms. They start maybe hearing voices or becoming so disorganized that they can't express themselves. When you start seeing those kind of changes, things what we call neurovegetative symptoms, changes in the biology, that's when medical treatment becomes very, very important. And intervention is best done as quickly as possible. When symptoms go on for longer periods of time, the effects on the body become more severe, and it actually becomes harder to treat. And sometimes those symptoms can become permanent symptoms if the intervention isn't done soon enough.
Mm-hmm. Now, Dr. McDaniel, can you, why there are people who have this problem? Some people does not know.
Mm-hmm. Yes.
And then why people live in denial?
Yes. It's a good question, and it's an issue that we see in psychiatry all the time. It's very common for people with depression to be aware that they feel down and blue, and many times will seek help.
Yes.
Some exceptions would be men oftentimes may be in denial about their depression. They believe that they just need to be strong, they need to be stoic. Women can do this too. They may be having families. They just feel like, I just need to buck up. I just need to be strong and pretend that this isn't as severe as it is. And it serves them to pretend that it's not as bad as it is. Many times because they fear to acknowledge that they're really suffering. Sometimes people can see these disorders as a weakness of character or some kind of a statement that they're unable to cope, when in fact it has nothing to do with the ability to cope or not cope. These are illnesses that have that can manifest themselves sometimes for no other reason than they inherited the disorder, or their body has just become so run down that then you start seeing biological changes. Bipolar disorder, on the other hand, one characteristic of the illness, especially when people develop symptoms, is what we call lack of insight. One characteristic of being manic is that people are actually not aware that they're ill. Sometimes the feeling of the symptoms themselves of being manic is a form of elevated mood. Sometimes people can have lots of energy. They don't need sleep. They talk a lot. Their thoughts race. They may have periods when they think they have tremendous insights. And sometimes, actually, in early stages of the illness, they can be very high functioning. But as these episodes become more severe, then their functioning starts to deteriorate. But many times, it's very characteristic of someone with manic episodes, as part of the episode, to lose insight into the effect that they're having on other people, and to actually be aware that they're ill, because they don't feel like they're suffering. They actually feel good on the inside. And many times they like that feeling. And so it becomes hard for them to recognize that this is actually a state of illness.
The effects of depression are staggering. A recent study sponsored by the World Health Organization and the World Bank found major depression to be the leading cause of disability in the U.S. and worldwide. 80% of suicide are carried out by persons who have depressive illness. 15% of people who have significant mood disorder commit suicide. Without effective treatment, the illness can lead to academic failures in our teens. 32 to 40% eventually drop out of school, and only 5 to 10% finish college. Children not able to focus and have classroom behavior problems. Children being neglected by parents who have bipolar depression. Adults with ADHD are more likely to have marital problems and multiple marriages. Even higher incidence of separation and divorce. Today we will be talking about ADHD, bipolar depression disorder. You would hear life stories on how others got their life on track and now have successful, productive life. You are not alone. Call the number that appear on the screen, or you may want to log on fltim.com.
The other reason that it's very difficult for people to accept this is because at some level they know this is a very serious illness, and they become very concerned that if they address it, that they're going to acknowledge that they have a serious problem. And that's very scary for people. It's very scary to acknowledge that they may have some debilitating illness that needs treatment, and they may not be aware that it actually is something that lots and lots, millions of people have both of these illnesses. And they're very much oftentimes unaware that there are treatments, and oftentimes can be treated fairly easily in some cases. And so many times with psychiatric illnesses, people don't discuss those. They're quite unaware that major depression affects about 1 out of 4 women at some point in their lifetime. Men, it's about 1 in 10. But on the other hand, sometimes we think we may underestimate the amount of depression in men because they don't seek help. But it's not often that people talk about that, and they're unaware that probably many people they know have had treatment. Almost everybody, if you meet a family, they have a family member or someone they know close to them who has had one of these major psychiatric illnesses that needed treatment. But because people don't talk about it, there's a certain amount of shame still in our society. So people have the impression that they're suffering on this alone. They don't realize it's as common as it is. And so they think it's something to be ashamed of. Not being aware that they could walk down the street and talk to their friends and realize that many people they know have gone through the exact same issues.
What are some of the, you have the warning signs and then you have the danger signs.
Yes.
Can you tell us?
Yes. With major depression, I would say about 100%. Every patient I've ever treated who's had at least one episode of major depression, whenever they start to feel down or blue, will often become very scared that it's happening all over again. And so the warning signs for an episode of major depression isn't just feeling down, because even people with major depression who've been treated will have up and down days just like everyone else. But if those down periods start to linger, last for more than several days, especially if it starts lasting most days for 2 weeks, or especially if they start having neurovegetative symptoms, their sleep is altered, their appetite changes, their energy level changes, their concentration changes, those would be true warning signs, and if they're severe enough, danger signs that they're either having a relapse or this is the start of a true episode of major depression. With bipolar disorder, the symptoms, it's quite the same. People with bipolar disorder, they can have depressive episodes, but the warning signs for the manic episodes are actually the ones that have to be monitored more closely. When people are depressed, they often feel miserable, and they're more likely to seek help and acknowledge that they're suffering. People that are manic oftentimes feel better when they're manic, and so they will oftentimes pretend that everything is just fine. And but the warning signs would be when their sleep changes, they start having a lot more energy, they start talking a lot more, they start making all kinds of plans. Maybe they get on the phone and they're talking to many people. They start having all kinds of long-range plans, then sometimes engaging in a lot of pleasurable activities, sometimes impulsively and dangerously, spending money they don't have, sometimes putting themselves in danger, maybe making a protest or going to the governor's office because they have some agenda on hand, and not quite aware that they're actually behaving quite bizarrely or behaving in a way that would be scary to other people. And the warning signs usually would be the changes in their vegetative state when they start, their sleep is altered, their energy levels, their appetite changes. Those would be the initial warning signs that this is not just a few good days. This is becoming, the illness is starting to manifest itself again.
What are some of the methods that you use to treat these disorder?
Yes. The first part of treatment is a good psychiatric and medical evaluation. There are many medical conditions that can present similar to bipolar or manic episodes or depressive episodes. So as a physician, a medical evaluation, including lab tests and a physical exam, is very important to make sure that these aren't a manifestation of some other illness. Major depression a depressive episode can be a symptom that is characteristic of other illnesses, hormonal problems, thyroid problems, cardiac problems, chronic infections, all sorts of things. Literally, probably about 200 illnesses can present with depression. So one very important part of the treatment is getting a good medical evaluation to make sure that this truly is depression and bipolar disorder and not a manifestation of a physical illness. After that, a good psychiatric evaluation to help identify what is the illness. Many times people may present with depression and not tell the doctor about the manic episodes, sometimes not even aware that they've had manic episodes. So with psychiatric illnesses, getting the family involved is oftentimes very helpful. Initially, sometimes just to get information from the family in terms of what they've noticed. Sometimes they will notice things that the individual themselves do not notice. The treatment after that is often very confidential, so that the person can feel like they can talk about these things and develop and start to relax and start to be able to identify some of the ways that they've tried to cope in their life and begin to acknowledge some of the ways that they've had difficulty and stop getting out of the state of pretending that things are going better than they are.
Today we will be talking about ADHD, bipolar depression disorder. You would hear life stories on how others got their life on track and now have successful, productive life. You are not alone. Call the number that appear on the screen, or you may want to log on fltim.com.
Once an evaluation is done, and if we do identify that these the presence of a severe major illness, such as major depression or bipolar disorder, in those cases, medication is very, very important. And once we've identified the nature of the symptoms, maybe the characteristics of the symptoms, trying to identify the right medicine for the right person is oftentimes not easy. We can look at each person is unique. Each illness is unique, and each presentation of each illness is unique. And so we try to match up medications for the person, but oftentimes, as people will experience in psychiatry, there's a little bit of trial and error involved, which gets very frustrating for people, and so it takes some patience sometimes on the patient's part to be able to realize that this is part of the process. Is we may use one medicine and maybe the side effects don't agree with them, and so we may have to try something else. And that is just the nature of the process itself. If the major symptoms, once they're under control, so that the person is able to think more clearly, to be able to focus and be able to engage in therapy, then therapy becomes a very important part of the whole process. So they can begin to understand their illness, learn different ways of coping in terms of managing their illness and understanding what they need to do, maybe some lifestyle changes that will help them to manage their symptoms, and also to learn maybe some self-defeating behaviors that they have, or maybe even behaviors that they've had their whole lives that really don't help them accomplish what they want to accomplish. And that takes time for people to feel comfortable enough to begin to recognize that. And finally, another part, a very important part of the process is involving families. Families oftentimes don't understand what these symptoms are about. It's hard for them to understand why a loved one would behave the way they do, why they don't just snap out of it, or why they can't seem to get a hold of themselves or get control of themselves. And sometimes the symptoms can actually be very scary, especially to children in the family. And so getting the whole family involved, one, to help with developing skills for the family members, help them identify symptoms, and help identify a process of communication with the family so that they can help the person identify their symptoms and manage it. Many times it's actually very difficult for families and for the individual with the illness, oftentimes can be labeled as the sick one in the family. So when there are natural conflicts that occur, the tendency then is to blame the person who has the diagnosis. Well, it's their illness, or they're the ones who are causing all the problems. And then oftentimes then the person will get rebellious and not want to treat their illness because they feel like they're being blamed for all the conflicts in the family. So that becomes a very, very routine and important part of helping the individual manage their illness, is helping the families develop a healthy way to manage the illness without making the person who has the symptoms labeled as the bad one, so to speak. That this is not good or bad. This is just it's an issue for the whole family to cope with, and help give families hope to realize that there are lots of people who've been through this. We have lots of experience, and we have lots of information about what works and what helps families. And also then the final part that's very important is helping families and individuals get connected with support systems. Support groups and things, so that they realize that they're not going through this alone as individuals or alone as families.
Yes.
And they can get that support through support groups, through their church, through maybe even members of their friends in the community who would be willing to, who they're willing to share their troubles with, and then everyone then becomes part of the support system. And that's very common in my practice. Someone with these major illnesses, oftentimes we have someone that they've designated, which may be a friend, even a neighbor or a family member, who will often call and let me know if the person is having symptoms, so that we can intervene in a way that's helpful without the person feeling threatened, and not waiting till symptoms have become so severe that then we're looking at hospitalization or something like that.
Well, you have educated us. It is very, very interesting, and I trust that the audience out there that they're watching, that this interview has been help and answer some of the questions that you may have of your loved one or close friends. We want you to support them, stand together with them, because this is a disorder that there are so many people that are wonderful people, and they deny it because they don't want to be marked as some crazy, bizarre person. And but when families are educated, they can better support them and stand together with them in this crisis or episode. And people can go on with life as long as they take their medication.
Absolutely.
We want people to know this, that once they are treated.
Thanks for watching today's telecast, A Better Life. Remember to contact us using the information on your screen. Pastor Barbara Ann Reese and the Faith Life Tabernacle family looks forward to hearing from you. Your life will never be the same. A better life is yours. Believe it, receive it, and walk in it.